Welcome everyone to today's webinar, Nurse Self-Care, How to Empower ASC Clinicians to Prioritize Wellness. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation and have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We will have a series of poll questions during today's webinar. You can submit the answer that best applies to you directly on your screen in the slides box. Thank you in advance for your participation. Today's session is being recorded and will be made available after the event. You can use the same link you used to log into today's webinar to access that recording. And finally, if at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I'm pleased to welcome today's speakers. Marvella Thomas is Senior Consultant of Clinical Operations for ASCs with Cardinal Health, and Deanna Endell is Senior Clinical Consultant for Post-Acute Care with Cardinal Health. Along with a broad portfolio of medical and surgical products, Cardinal Health has dedicated resources and tailored solutions specifically for the ASC space, making them a leading distributor for surgical hospitals and ambulatory surgery centers. Their tenured team of ASC representatives know how ASCs operate and are there to help your facility reach its goals. They work together with a clinical team of perioperative nurses that work specifically with ambulatory facilities to improve efficiencies and maximize revenues. Their tailored solutions are designed to help ASCs optimize efficiency and streamline their supply chain. Marvella and Deanna, thank you for being here today. Marvella, I'll now turn the floor over to you.
Okay, thanks. Thanks for the introduction, and a special thanks to the audience for joining us today. During the webinar, we're going to cover three specific areas or topics. First, we're going to discuss the current state of wellness and how COVID-19 has affected your clinical team. We're going to talk about the impact that the pandemic has had on your facility from a financial and efficiency perspective, specifically how stress can affect your bottom line. And then finally, we're going to leave you with tips on implementing and promoting self-care strategies for you and your staff. We're really talking about care for the caregivers and maintaining a healthy and profitable environment. So as we begin, let's see how the audience has been impacted by the events of this past year. Let's start with a poll question. How would you rate the negative impact COVID has had on your lifestyle, job performance, or productivity? Have these events been a huge impact on your life or not so much? So Deanna, while the audience is weighing in, we've had some significant changes to our lifestyle with COVID. Pre-pandemic, we were traveling every week to customer and client sites, but with travel restrictions, we've been grounded most of the year. That was a huge adjustment for us. We were working from home and supporting customers virtually. In fact, we had to develop new consulting processes so we could continue to support our customers. We had to totally rethink how we did business. So let's see what the audience had to say.
Yeah, Marvella, we sure did have some major adjustments that we had to make to the way we conduct our business. And it's actually not too surprising to find out that 41% of our audience reported a huge impact. 45.7% said big impact, and 0% of our audience reported no impact at all. What are your thoughts? Is this consistent with what you've seen and heard out there?
It absolutely is, and that's what I was kind of expecting to see. This pandemic has had a huge effect on us and our teams. So let's take a high-level look at what's been happening. There are over 25 million Americans that have contracted the virus and 419,000 deaths. Most of us have had someone in our personal circle that's been affected. 3.7 million people became permanently unemployed, and many of these were nurses and friends. Of those surveyed, 38% admitted they were having difficulty paying their monthly expenses. That has to have an impact on your team's psyche and morale, and these numbers are rising daily. These are some broad general statistics, but let's talk about what's happening to our clinicians and the rest of our teams. There's been a tremendous impact. Many of our ambulatory facilities were actually closed during the initial lockdown, and some have closed permanently. Nurses were furloughed, and who would have ever seen that coming? This created stress from loss of income and sometimes loss of their benefits, and in many cases, their spouse was affected as well. Some ambulatory surgery nurses were actually reassigned to the acute space if their center was affiliated with a hospital. Think of the stress that created. And these are just some of the scenarios on the ambulatory side. Closures, furloughs, lost jobs. But the impact was quite different in your world, Deanna.
Yeah, Marvella. I support primarily the post-acute care sector, where they've also seen quite an impact. While some of the smaller chains and individual nursing homes had to close their doors completely, others have experienced significantly lower census due to the pandemic, and many have lost staff due to COVID-19. Some to the illness itself, and others to just those increased demands from home that you spoke of. So this, of course, puts a strain on the remaining staff to pick up the workload, right? Which means many are working extended hours, perhaps providing care in ways that they haven't in the past. I spend a lot of time with wound care staff out there in the post-acute care market. And one example, often in hospitals and nursing homes, they'll have dedicated wound care nurses that specifically focus on this specialty area of care. But with all the increased demands as a result of the pandemic, these nurses are filling in wherever they're needed. And then all the other nurses are having to pick up the burden of wound care. This can really cause added stress for the staff as well as the patients and residents in the facilities.
Right. It does sound like there's additional stress on your side of the market. Well, we were all happy to see the lockdown lifted and elective procedures were being scheduled again, but that brought additional challenges and stress for our nurses and physicians. To manage the influx of procedures and to try to recapture some of our lost revenue, we started seeing increased hours of operation, and some facilities were even opening their doors on weekends. So this meant longer hours and additional childcare needs for the staff. Additional specialties and procedures moved from acute settings, and these procedures were much more complex than what we had done in the past. They took more time, more supplies, and more resources. And we're still struggling with supply shortages, not just for PPE, but other high-volume supplies as well. And who takes the brunt of the complaints when your staff can't provide the surgeons what they need? So stress is not only happening at work, but home's not a safe haven anymore. Staff is dealing with a lack of childcare options. Daycare centers and schools may be closed. And after the stress of working and nursing all day, they may have to go home and put on a teacher's hat. They may also be caregivers, not just for their children, but sometimes parents or other relatives. And with limits on recreational and social activities, they really don't have a place to relax and de-stress. There are no spa days or girls or guys nights out. And this stress is in addition to trying to keep themselves, their patients, and their families safe from the virus. It's no wonder they're experiencing burnout. This burnout will eventually take a toll on your productivity and bottom line. So what's the impact of burnout on your facility and your bottom line? Let's poll the audience again. So what stressors have you felt at your facility? And you can check all that apply. Has it been retaining staff, new protocols, decreased volumes, more complex procedures, or finding supplies? And it may be all of the above. So let's see what the audience had to say.
Wow, Marvella, as you can see, 70% of our audience said that retaining staff is a stress that they're feeling. New protocols, 86%. And then decreased volumes, 44% of our audience identified that as a challenge, taking more complex cases, and certainly finding supplies. So again, these I don't think are too surprising to us, but is this something similar to what you're hearing?
It really is, and I think we're on point with making sure we have the resources to take care of our staff. This is absolutely what I see and what I hear administrators and managers talk about. They know the tremendous stress their clinicians are feeling and dealing with, and they actually feel helpless about relieving that stress. And we also need to remember that our leaders are also experiencing some of these same stressors. Burnout and stress do impact your bottom line. You've probably experienced increased call-offs. Sometimes it's for physical symptoms of stress, sometimes for illness. Sometimes it's to quarantine because someone in their household has contracted COVID, or simply because they don't have child care for an at-home school-age child. There's increased use of per diem staff in your facilities, which is more expensive. But in addition to the added salary expense, clinicians that are not familiar with your facility actually increase the stress on your regular staff. And those per diems don't always support your strategies and initiatives for efficiency and cost savings. They're just not aware. Stress can lead to safety concerns in your facility because studies have shown that stress and distraction can lead to an increase in accidents and never events. And how much does it cost you to recruit, onboard, and train a new employee, even if you can find one? It's much easier and less costly to retain and support your existing staff. Stress can also have a negative impact on customer satisfaction and patient outcomes. Patients don't have the support of their caregiver and family while they're in your facility. Your clinical team has to put that hat on as well and support the patient's emotional needs. There may be language barriers or other difficulty understanding teaching and discharge instructions. So this increases the frustration for patients and for your staff. Canceled or delayed procedures not only impact the patient mentally, but they can also take a physical toll on the patients. They're dealing with pain or other debilitating effects of their illness. These can actually exacerbate with delays in treatment. And we also need to remember our physician customers. They feel the stress also. They've lost revenue, and physician owners wonder if their facility can survive another lockdown or decreased activity. Some surgeons have had to move their elective procedures out of the acute setting where they're comfortable and into your center. So now they're dealing with new faces, new processes, and new supplies. It's not business as usual for them either. And new protocols have increased the pressure on our limited resources. Most of our surgery centers don't have housekeeping staff, so these enhanced cleaning and turnover procedures have added time to our process, and they've made more work for your team. Wearing different hats is also having an impact on your business office and reception staff. They're involved in cleaning protocols and wearing PPE themselves. And we need to make sure that they have the education and support they need for these additional responsibilities. So Deanna, with everything that our staff is faced with on a daily basis, how can we as leaders support the staff and maintain a healthy clinical and a healthy bottom line in our facilities?
Thanks, Marvella. You know, that's a lot of information that we just shared, right? And if we had a magic wand, we would sure wave it right now, but we don't. So let's talk about some things that we can do. So these challenges we're seeing in all areas of healthcare, as I mentioned earlier, certainly in the post-acute care market, but also in acute care hospitals, ambulatory service centers, as you've mentioned, and rehab facilities. Everyone's looking for help. So now that we've validated a problem exists, let's spend some time talking about what we can do to help alleviate some of the stress our teams are facing. So one way to address the negative impact of stress burnout is to practice and promote self-care. You know, research shows that nurses are more likely to be overweight, have higher levels of stress, and get less sleep than other members of society. So the question is, how can we expect them to take care of others if they aren't taking care of themselves? Well, how about prioritizing staff wellness first and foremost? You should be talking about it as often as you can, communicating your message as often and through as many outlets as you can. Maybe that's in your staff meetings or weekly email notifications, maybe break room posters. You know, whatever it takes to get the word out that self-care and wellness is your priority. Maybe encouraging self-care. You know, many of us, not just nurses, just need someone to give us permission to take care of ourselves. You know, a simple statement like it's okay to do something that's just for you can go a long way. Or maybe giving time to your staff for exercising or providing support for weight loss or mindfulness meetings. These are all ways to encourage and support self-care. And of course, lead by example. So, you know, you as leaders, everyone is watching to see what are you going to do and how you're going to do it. So make a commitment to yourself and to your teams to take care of you. In fact, I recently spoke with a colleague that manages a team of wound care nurses in an acute care facility, and I asked her how she's helping her staff deal with the increased stress that they are all facing. She said the most important thing is to model good behavior. Show them how to find a few minutes throughout the day to just recenter and prepare for the rest of the day. It actually reminded me of a program that I had instituted many years ago with a nursing unit that I had managed, where we made mindfulness part of our daily huddle. At the beginning of each shift, when we gathered at the nurses station, we would end our huddle with 5 minutes of silent meditation. Now, as you can imagine, the first few times there was a lot of giggling and looking around, but after we did this for a couple of weeks, we actually noticed that there were staff from other units coming by to check out our meditation minutes. And before you knew it, we were hearing about other units that had implemented this as well. So it really made a significant difference in our employee satisfaction. And I can't think of a better time than now to try something like that. So while I was doing my research for this discussion, I came across an interesting article that was actually written for the American Journal of Critical Care in January of 2020. And the author, Cindy Monroe, wrote, "First, let us respect and take care of ourselves. Second, let us individually and collectively respect and take care of all our coworkers. Each of these resolutions will support our own health and the health of our work environments." So in fact, in the article, she used the analogy of standard airplane safety briefings. You know the part when they advise passengers to put their own oxygen mask on before helping others? Well, this focuses on self-care and underlines our recommendation that first we should respect and take care of ourselves. And we all know how difficult and challenging 2020 was for so many, particularly in the healthcare industry. I do wonder how many of us actually had the opportunity to, well, let me rephrase that, how many of us actually took the opportunity to take care of ourselves first. Now, I'm sure we all know that burnout and lack of self-care can have significant impact on our business. We've seen that in some of the poll questions already. And I'm sure we all agree that this is an area that needs to be addressed in order to facilitate healthy growth and positive outcomes. So where do we go? What can we do? Well, there are a multitude of programs out there designed to promote healthy work environments. Maybe you have access to employee assistance programs through your benefits program, or maybe your health insurance provider offers something in your benefits package that's designed to help staff with maybe weight loss or smoking cessation. There are just so many options out there. There are also a lot of programs out there designed to help you with mindfulness, meditation, mental health, as I said, weight loss. The list just goes on and on. I do want to spend a few minutes, though, talking more about another discovery I made while researching for this discussion, and that's the Healthy Nurse, Healthy Nation initiative. So keep in mind, this was specifically targeted for the nurses in our country. And quite frankly, maybe some of you are thinking to yourselves, wait a minute, nurses of all people know the importance of taking care of themselves, right? Well, not necessarily. For example, as I mentioned earlier, research does show that nurses are more likely to be overweight, have higher levels of stress, and get less sleep than other members of society. So the American Nurses Association launched the Healthy Nurse, Healthy Nation initiative back in 2017. And it was founded in the basic understanding that in order to take care of others, nurses must first take care of themselves. Healthy Nurse, Healthy Nation is a structured framework that's really designed to transform the health of the nation by improving the health and well-being of nurses. What a concept, right? The belief is that if we can get our 4 million registered nurses in the U.S. to take care of themselves first, they'll be better equipped to optimize the health of their patients. And by focusing on these 5 initiatives, physical activity, nutrition, rest, quality of life, and safety, nurses are better suited to advocate for their patients and educate them on healthy lifestyles. So some self-care tips. There's an app out there for everything, and there's even a commercial for that statement. There's an app for it. It's become a mainstay of our lives, particularly during these times of social distancing and alternative methods of meeting and gathering. It's also proven to be an easy method of accessing various types of health care and self-care. So for example, mindfulness, I spoke about this a little bit earlier, but there's several apps out there. One I pulled up, the MoodFit mobile app, that helps to prioritize and track sleep, nutrition, exercise, and more. And you do it right from your phone. Mood Fits mobile app, that's that one. And then there's Headspace. I think lots of heard of Headspace. Meditation and mindfulness for any mind, any mood, any goal is their tagline. But also there are podcasts out there if that's what you prefer. So for example, there's a platform called A Nursing State of Mind, and their podcast episodes include things like who is on your team, or balancing work, life, and COVID-19. Hope is an action word, and who has time for self-care, and one called Watching Your Emotional Signals. And then here's an interesting one, Reconnect with Your Passion for Nursing. How many of our nursing colleagues have left the profession because they're just simply too exhausted? So let's talk about nutrition. An easy way to start, and this is a great time of year to talk about that, right, with our New Year's resolutions. So the U.S. Department of Agriculture recommends starting simple. So with the My Plate app, it's designed to set healthy eating goals, track your progress, and celebrate your success. And when it comes to physical activity, there are hundreds of apps that are designed to suit everyone's needs. And of course, these are just a few programs. In fact, Marvella, I believe you have some additional insight on this subject that might be specific to ASCs. What have you found?
Man, that was great information, Deanna. And most of the information you shared is applicable to all of us as nurses and caregivers. You mentioned some of the options that I'm going to talk about, but I do think that they bear repeating. If you're managing a smaller or an independent facility, you probably are the HR and EAP department. So that may not be an option for you. But if you belong to a management organization, or if you're managed by an outside organization, you may have resources through them. Professional organizations, Deanna mentioned the American Nurses Association, but AORN, which is specific for operating room nurses, is also offering wellness programs and resources. And again, the company that provides your employee health benefits will most likely have a wellness program as well. Don't forget your state and local health departments. They also have workshops and resources to promote self-care. I live in the state of Missouri, and both our Department of Health and the Department of Mental Health have stress management and self-care programs. These programs are online, and they're offered at no cost. So you can tap into those and encourage your staff to take advantage of these resources. Place resource information in your lounge and locker rooms and make it a topic of your morning huddle, like Deanna said, or an educational session. Some of these resources may also be able to host a virtual meeting for your team so they can discuss the program they have and offer options and answer questions. And finally, your staff would be the best place to look for what would be most important to them or what they feel would help them most in mitigating stress and burnout. So give your team a voice and a choice. I'd also like to share some ideas that I've seen in action when visiting facilities that have provided some support to staff and lessen burnout. I know we all have a business to run, but keeping your staff healthy is important in the long run, and it's actually a part of running that business. Offer flexible schedules for staff and procedures. Can you start later one day a week or close earlier? Can you flex individual schedules to support needs at home? I was in one facility that had a nurse who was sharing child care responsibilities with a spouse who worked nights. flexing her schedule to let her come in after her spouse had gotten home from work allowed them to safely pass the child care baton. And are you providing a healthy work environment for your team? Studies have shown that trying to work in a cluttered, unorganized environment has a direct impact on mental health. Keeping your facility clean, organized, and orderly not only reduces stress, but actually increases your efficiency. It's important that both sides of the red line look the same, so make sure that your ORs are just as pleasant to work in as your waiting room is to sit in. Break rooms are often small in our ambulatory facilities. You know, break rooms don't generate any revenue, so no one thinks about those. Stagger your breaks and offer alternative areas for your folks to sit and relax. Maybe a conference room or the waiting room if you're not allowing visitors in your center. Allow staff the space to social distance and to feel comfortable in their break environment. Are you in a location where outside space is available, maybe for a patio or seating area? It helps with social distancing, and people also get some healthy sunshine and fresh air. So think about giving your staff that opportunity and maybe time for a quick break walk if possible. With no cafeteria, can you provide an occasional meal to your staff? Or are there local eateries that might help provide meals or snacks? And this is also a great way to support your local business community. Is there a local business that might be willing to provide chair massages at your facility? Or could you provide a gift certificate for a relaxing massage? And finally, use technology to keep your patients connected to their caregivers. Tablets and phones help them pass the time, and it relieves stress for them and their families. And in turn, it relieves stress for your staff. Deanna mentioned a lot of apps that are available to promote wellness and self-care, so make sure you share those opportunities with your staff. Something else that's easy to set up, easy to develop, is an employee recognition program, and that can also help improve staff morale. An employee recognition program is a simple and low-cost way to let your team know that you care about them and that you appreciate all they do to make your facility successful. This toolkit provides printable certificates and badges that can be awarded to staff. These badges can be worn on their name tags during the day, and the certificates can be displayed on a special wall of heroes for all to see. So these are just a few suggestions to keep your staff and facility healthy. So as we wrap things up, Deanna has a final poll question for you.
Thanks, Marvella. Those are all wonderful ideas and recommendations, so thanks for sharing. You know, I'm reminded as we've just talked through so many different options that there's really no one silver bullet that's going to fix everything. It's really just spending a little time to see what's going to work for your individual facilities and staff members within your facilities. And most likely it'll be a combination of things. So our last question here for the audience is pretty straightforward. After we've talked about all these things you can be doing for yourself and your staff, we're just curious to know how many of you actually do something routinely for self-care. So go ahead and put your answers in there and take a look at the results. So that is really encouraging to see. Almost 70% of our audience does something to take care of themselves routinely for self-care. About 30% no. For those of you that answered yes, wonderful. Then you already understand the benefits of that. So hopefully you found something useful throughout the presentation that you can take back to your teams. And for those of you that answered no, we hope you've also found something in the presentation that's informative and will give you some ideas of how you can take care of yourself and really see the benefits of self-care so that you can help pass that along to your teams. Now we are going to turn it back over to Molly, our moderator, and she's going to kick off the Q&A session. We've had a lot of questions come in, and please don't stop now. Send your question in. I will spend the rest of our time trying to get those answered for you.
Terrific. Thank you, Deanna. Thank you, Marvella. That was a great presentation. So attendees, we will now begin today's question and answer session. You can submit any questions you have by typing them into the Q&A chat box you see there on your webinar console. Let's get started with our first question. We had an attendee write in and share this with us. When you've offered all these programs for nurses, how do you get them to actually take action on the programs? They're exhausted and running on fumes, so I don't feel they can take time for themselves. Deanna and Marvella, do you have any insights you would like to share with this attendee on this, this challenge she's running into?
Yeah, this is Deanna.
Well,
I'll start.
You can start. Go ahead.
Okay. We're both going to jump on this one. That's kind of the whole point of this presentation, right? To try and give you as many different options as possible so you can help find something that your nurses can do. Because I'm here to tell you that if they don't do something, they won't last. They can't keep up at that pace. So any little thing, you know, maybe they start with an app on their watch or their phone to just breathe throughout the day. If any of you have experienced that, it's 1 minute that you dedicate to closing your eyes and focused breathing. And it is a great way to start and a place to start because it's just 1 minute. Marvella, how about you?
Yeah, I think number one, you mentioned being a good example, and I think that's a great place to start. But I think you also have to listen to your staff, know your staff. You can tell when someone's getting stressed, getting burnout. You know, they're short with answers, and as nurses, we can kind of pick up on those things. Talk to those staff people. Tell them that you recognize the stress that they're under. Ask them what would help. You know, sometimes it's the things that we do and leading by example, providing lunches for them, making sure that they get a break. Encourage them to, you know, go take your break and make sure that no one bothers them while they're taking their break. I think those are all things, just being respectful of our staff, listening to them, and then providing them with opportunities. And I think one of the things Deanna mentioned is giving them permission to care for themselves, just making sure that they know it's a priority. I know in our organization, our senior leaders have told us that 1 day a week, and they pick the day, we're supposed to take 2 hours for ourselves for self-care. So maybe it's flexing someone's schedule so they have time for that.
Terrific. Some excellent insights there. Thank you so much for weighing in, Deanna and Marvella. Marvella, I'll do this question to you first, and then we'll check in with Deanna to see if there's anything she would like to add to it. But this attendee wrote in saying, at work, we offer some great stress relievers and perks. However, at home, many of our staff have issues with the physical and psychological effects of isolation. Are there any ideas you have on how we can help improve their home life? If they're not happy at home, they will not be happy at work. Marvella, do you have any suggestions you would share with this attendee?
Yeah, and that's very true. And a lot of times we feel like there really isn't anything we can do to make their home life more enjoyable. But I think, we all watch the news and we see all of the families that are having trouble accessing food and going to food banks. And I think just being open and honest with your employees and making sure that they have access to resources, making sure that if it's food that they're having trouble accessing, if it's childcare, are there resources that you can hook them up with, that can help them with that? Again, it just boils down to listening to your team. And if you can make it less stressful at work, it's also going to impact their home life.
Sure. Thank you, Marvella. Deanna, is there anything you'd like to add before we move on to the next question?
Yeah, a couple of things that have come to mind are, there are online or telephone or Zoom counselors out there specifically designed for healthcare workers. I know a lot of that was the focus on those frontline workers that were in ERs and ICUs taking care of COVID patients, but it's really evolved over the past year as there's just become more realization of the stress this puts on all healthcare workers and people in general, particularly with the isolation. Take advantage of Zoom, encourage that. It does not replace that human interaction, but it can help bridge the gap right now until we can get back to some sense of our normal lives pre-pandemic.
Well, and when you mentioned Zoom, Deanna, it reminded me of an activity I'm involved in. I have a group of nurse colleagues, and every 2 weeks we have a Zoom call happy hour at 6 o'clock in the evening. So we can all, get online, we can see each other's faces, and just talk about, what we're dealing with on a daily basis. So again, that's a part of technology that, maybe your staff can connect with other colleagues on a Zoom happy hour.
Terrific. So for those employees or colleagues who are struggling with the psychological and physical effects of isolation, I'm hearing really listening to your team can be of great help. Also connecting them with helpful resources, including virtual mental health resources. We had another attendee who wrote in facing another type of challenge with staff. Let me share this concern. What can I do with staff who are hyper-focused on COVID-19? I have some staff who are absolutely preoccupied with state and business policy and practices. So, Deanna, Marvella, I think this is a relatable scenario. Anything you would advise for this attendee?
I was going to let Deanna go first, but I'll jump in here. And we all know those people who are super or hypersensitive to COVID. Just making sure, I think, that we're aware of what the latest recommendations are and that we practice safe care in our facilities. Again, providing, adequate break space so they're not, sitting on top of each other in the break room. Just making sure that as much as possible, we follow the guidelines that are appropriate in our center and our setting. And then just make sure that, again, it's listening to your staff and asking them, is there something we're not doing that would make you more comfortable? That's probably the best way to address it, just making sure that you're following the correct protocols for your particular setting.
Perfect. So being informed and go ahead, Deanna.
Oh, sorry about that. No, I cut you off there, Molly. Go ahead.
I was just saying, I'm just going to summarize what Marvella said, but being informed and being aware of those same practices and policy regulations and the information that staff is preoccupied with, it sounds like that is really important at that time to be aware of those same matters. Deanna, let me turn over to you for any other thoughts on that question before we'll move on to some others that are coming in. Some great questions, by the way, from our attendees.
Yes, thank you, Molly. I was just going to agree with Marvella's statements, and I'm reminded of the challenges that I have with my grown children, my daughters who are out of state in school, and the stresses that they face, and I'm reminding them, stick to the facts, and you don't have to watch the news and be online researching all day. Get your daily updates, but get it from reliable sources, and make sure that you're following the protocols that are recommended by, reputable organizations like the CDC. So that trying helps them to not get too overwhelmed with it. But in a work environment, certainly not having the TV playing all the time in the break room if that's the situation with, all of the different news on there, because it just can be so overwhelming.
Certainly. No, absolutely. This next question, I'm really looking forward to hearing your insights here. So Deanna, we'll kind of ping pong. I'll stick with you on this one, and then we'll check in on with Marvella. But this attendee would like to know, what are some creative things that senior leaders have been doing to be more visible and engaged with the front line during these times?
That's a great question. So thank you for asking. Some things that I've seen out there in the post-acute care sector, I'm going to start there first, are from a corporate perspective, the corporate leaders having those Zoom calls on a regular basis, making opportunities for that virtual face-to-face conversation and asking those questions so that the staff can ask the questions and so that the leaders can validate that there are concerns and there are needs from the staff. As Marvella mentioned, asking your staff, what do you need to feel better? Is there something that we can do to help you? I'm reminded of just our call this morning where our senior leadership spoke to the organization about the importance of self-care and caring for one another. So again, that giving permission, that sounds so parental, but it's really just as humans, right? We are giving our colleagues and coworkers and friends the permission to feel that anxiety and acknowledge it, and then do something for themselves to help to alleviate that. What do you think, Marvella?
I think one of the biggest things, and again, I'm going to say, lead by example, but probably the most important thing a leader could do is to be visible. Make sure your staff sees you, they see you doing the right things. Again, leading by example. When I go into a facility, the ones that seem to be the most successful are the ones where I not only see the staff involved in patient care, but I see their leaders working with them and maybe not providing care, but in the area listening to the comments, listening to what's going on, and being actively involved. I know as an administrator and a manager myself, there was a lot of things that I had to do on a daily basis my staff was never aware of. If they don't see you, they don't think you're busy, and even though you're extremely busy. But that's why I think it's important, especially during these times of heightened anxiety and heightened stress, that you become more visible to not only your staff, but your physicians as well, so that they see that you're actively involved, that you care what's happening to them and to their patients.
Perfect. Lots of great food for thought there from both of you to that question. And attendees, thank you again for the questions you've been submitting. You had the closing poll that showed about 70% of our attendees currently do something routinely for self-care, which is terrific, but about 30% do not. This next question is, if you were to start managing an ASC with a focus on self-care, what would be the first suggestion you would act on if you were just getting started here with a routine? Marvella, can I stay with you and get your thoughts on this question?
Well, again, I don't want to sound like a broken record, but, listening to your staff, talking to your staff, and knowing where they are today, and then setting some goals for where they would like to go and where you would like to take them as a team. I think that's probably the most important thing. I find it hard myself to do self-care, to spend quiet time, to meditate. It's very difficult because we're all busy and we have lots of things to do. But I think just shutting down the chatter for a while, like the TV in the break room. And I know cell phones are important to stay connected to your family and friends, but if I want to focus on self-care, I have to get totally away from the distractions of daily life. So I think maybe just giving your staff some quiet time or a quiet place where they can relax and de-stress. And I really like the outside, but I do live in Missouri and we got snow last night, so it's not such a great idea for a lot of places, but truly, I can't tell you how valuable some outside space can be for your staff.
Terrific. So really defending them and protecting them from some of the distractions, the demands on their energy and attention, preserving and protecting them with some quiet time when you can. It sounds like those are some small but really important game changers. Deanna, did you have any thoughts on these questions in terms of a starting point you would advise for attendees?
Yeah, I did see some comments in the Q&A box about providing them choices to give them something to choose from, and I really agree with that. If you're talking to your staff and you started off with, of these 5 items, what are your top 3 priorities for, feeling safe and comfortable to come to work? Or what are the top 3 options for self-care that you would like to see us support? That way you're giving them something to think about and to get them, thinking in that mode, and you set the tone that this is important to us. This is a priority. We want you to be well and take care of yourself. And having a leader, Marvella and I have a leader that truly supports our self-care and asks those questions regularly. Hey, I notice you have been working a lot of hours and you've got a lot of projects. Are you good? Can I help you with something? Can I take something off of your plate? Just knowing that we have that outlet, I think for everybody likes to know they've got somebody that's got their back, so to speak, and their best interest in mind. So I think that that's a good starting point. Set the tone from the beginning that it's a priority.
Yep.
Mm-hmm. Terrific. So checking in and really living by example and elevating it as a priority and an important practice. Finally, we're rounding out the questions here, but one question in closing: as this pandemic has regionalized and different areas of the country are seeing some different trends in terms of cases and hospitalizations and so forth, this question, I'm looking to get thoughts from you both on: do you see this lack of self-care as a problem of the pandemic, or has it been a slowly evolving challenge in ASCs that simply got worse over the past year? Deanna, let me check in with you first for thoughts on this.
So, yeah, interesting. I can provide a perspective from a long-term care lens, if you will, and that I think that the pandemic has definitely shown a spotlight on some challenges that we've been facing for some time. And if you can find a way to find some positives over the past year, I would say that that would be one of them. We now have a stage as nurses and healthcare workers. We have the attention of the nation and the world, some would say, to see what it is that we go through on a daily basis. It is certainly heightened now, but we've been able to identify, where there are processes that can be improved, or procedures, or just our perspective, our way of looking at things. So I think that, the problem's been there for a while. It's certainly heightened now, but the good news is that now we've got a seat at the table and our voices can be heard.
Terrific. Thanks,
Yeah,
Deanna.
and I would
Marvella,
agree.
any closing thoughts? Oh, go ahead.
Yeah, I would agree with what Deanna said. I think in the ambulatory space, it's been a crescendo that's been building. I know in our space, in our market, we don't have a lot of the resources that are in other healthcare settings. When we say ambulatory personnel wear multiple hats, boy, do they ever wear multiple hats. We don't have housekeepers, we don't have maintenance, we don't have a cafeteria. So we've always had to do more with less. And I think, like I said, it's just kind of been exacerbated with the stress of the pandemic. There have been so many stressors for people to deal with, in addition to all of the multiple jobs they're trying to do on a daily basis. So I think in the ambulatory world, it's been there, but now with the additional protocols, with the fact that, a lot of times families can't come in with patients, it has certainly exacerbated. And like Deanna, I'm very glad that we do have a seat at the table now and that people are actually paying attention to what's happening to our healthcare heroes and the sacrifices that they make on a daily basis.
Marvella and Deanna, I want to thank you both for an excellent presentation earlier and for responding to attendees' questions so thoughtfully. I also want to thank our attendees for those questions. And finally, I'd like to thank Cardinal Health for sponsoring today's webinar. To learn more about the content that was presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today, and we hope you have a wonderful afternoon.